Welcome back to Pharm Fridays, where we take those tricky meds and make them make sense. I'm your host, and today we're tackling a drug that's basically the OG of blood pressure control, Lisinopril. So grab your coffee, your stethoscope, and maybe your ACE study notes, because by the end of this video, you'll never forget what makes this med so ACE-tually important. Lisinopril is part of the ACE inhibitor family, the ones that relax blood vessels, lower blood pressure, and help the heart chill out. We use it for hypertension, heart failure, and after myocardial infarctions to give that overworked heart a breather. Okay, time to geek out, but in a fun way. Here's how lisinopril works. It blocks the enzyme that converts angiotensin 1 to angiotensin 2. Why does that matter? Because angiotensin 2 is a major vasoconstrictor. It tightens blood vessels and tells your kidneys to hang on to sodium and water. So when we block it, blood vessels relax, kidneys let go of extra fluid, the heart pumps with less resistance. So basically, lisinopril is like telling your body's plumbing system, hey, loosen up a bit. Now, before you give that dose, here's what you want to do like the pro nurse you are. Check blood pressure, especially systolic. If it's too low, that heart won't be happy. Monitor potassium levels, because ACE inhibitors can cause hyperkalemia. Watch renal function. Lisinopril and kidneys are like roommates. They need to get along. And of course, always remind patients to stand up slowly. Orthostatic hypotension is real, my friends. Let's talk about the famous side effects, or as I like to call them, the 3 C's of lisinopril. First, cough. ACE inhibitors can cause a dry, persistent cough, thanks to bradykinin buildup in the lungs. It's like the med's tiny calling card saying, hey, I'm working. If your patient's coughing like they've swallowed sandpaper, it might be time to call the doc. Second, cough's cousin, caution with potassium. Remember, blocking aldosterone makes the body hold on to potassium, which can lead to hyperkalemia. So skip the banana smoothie today. Third, catastrophic reaction, angioedema. Though rare, it's serious, swelling of the lips, tongue, or airway. If that happens, stop the med and get help immediately. All right, quiz time. You know the drill. Shout your answer before the countdown ends. Which electrolyte do we monitor closely with ACE inhibitors? If you said potassium, you nailed it. You're officially acing this Pharm Friday. Here's the quick rundown. Lisinopril lowers BP by blocking angiotensin 2. Always check BP, potassium, and renal function. Watch for cough and angioedema. And don't stop it abruptly. Consistency is key for the heart. If this video helped you ace your understanding of lisinopril, give it a thumbs up, share it with your study crew, and hit that subscribe button for more Pharm Fridays. Stay curious, stay clinical, and I'll see you next week.